Today I will talk about the upper and lower GI bleeding signs and symptoms. First, I will talk about the upper GI bleeding. So a patient comes to emergency room with symptoms for upper GI tract bleeding. How he or she would come to me as a doctor. Okay, let's draw. This is a patient. I don't know why I prefer males more than females. Maybe because females, I feel like I have a duty to draw females in a better way. So this is the reason maybe. Okay, so a male or a patient comes to emergency room, suffer from several things. What are these things? He suffer firstly, and the main thing that he suffer from and makes him to come to hospital is that he vomites blood. So he comes and said, I vomites twice today blood or something like that, and we call this in medicine hematemesis. What we call it? Hematemesis. Okay, so this is the typical symptom for patients suffer from upper GI bleeding. It is the hematemesis. He is vomiting blood. What else? What you suffer from? Ankle. I suffer from a pain in my abdomen. Maybe it is gastric pain if the reason was the stomach. And this would be in the stomach or in the first part of duodenum or in the esophagus, because this is upper GI bleeding, as it from its name, yani. Okay, so he put his both hands on his abdomen and suffer from an abdominal pain and hematemesis. What else? He suffered from something, not just hematemesis, red blood with vomiting. No, also he may suffer from coffee ground vomiting. What is coffee ground vomiting? It is black to brown vomiting, and it indicates that this blood is old blood, okay, or coagulated blood. So its color is like a coffee ground color. Okay, sorry. It's complete. So a patient comes to the hospital to emergency room, suffer from hematemesis and abdominal pain and maybe coffee ground vomiting. Also may comes to me and say that he suffered from a blood in the stool, and this not happen except if it was a massive bleeding. If it was a really massive bleeding, he will suffer from hematochezia. And what is hematochezia? It is a bright red blood per rectum. Okay, and this is just in case of massive bleeding from upper GI tract, from stomach or esophagus problems, or first part of duodenum. And if it was a massive bleeding, it will reach the rectum with bright red color. Okay, so what is the fourth symptom he may complain of? Is hematochezia. Hematochezia. I'm not sure from if it was correct like that. Okay, and more common than hematochezia, he will suffer from melena. And melena, it is black, tarry, shiny stool, black stool. Okay, so he just like it's black stool. We call it melena. So melena, if a patient comes to hospital with melena, suffering from melena, which is black stool, I will not think about lower gastrointestinal tract bleeding conditions. No, I will think about upper gastrointestinal tract bleeding conditions more than lower ones. Okay. While hematochezia, which is bright red blood per rectum, okay, it indicates lower than more upper GI tract bleeding. Okay, so patients come to me with vomiting bloods or coffee ground vomiting, and I said why it's coffee ground like, and maybe with abdominal pain, with melena more than with hematochezia. Hematochezia just in case of massive bleeding, as I said before. Okay, and melena, which is black stool. And why it's black stool? Because it is from the upper gastrointestinal tract, so it will pass through all the small intestine and then through all the large intestine and through the sigmoid colon and the rectum and anus. So during this path, it will be old blood and it will return to black in color as a coffee ground, I said. Okay. What else? Patients may suffer from syncope or fatigue because of bleeding. And bleeding causes what? Bleeding causes hypovolemic shock. So the patient comes to me with tachycardia, plus hypotension. Okay, plus maybe loss of consciousness. Okay, so these are the signs and symptoms for patients with upper GI tract bleeding, hematemesis, melena. These two things is the most common things for upper GI tract bleeding. Then coffee grounds, hematochezia, abdominal pain, fatigue, loss of consciousness, hypotension, tachycardia, which indicates hypovolemic shock. Okay. You may ask, what are those upper gastrointestinal tract conditions? Give me an example, Sham. Okay. We can know them through the anatomy. So how can we differentiate between the lower GI tract bleeding conditions and the upper GI tract bleeding conditions? Yani how and on what base we said from a thing that it is upper, or from another thing that it is lower GI tract bleeding? What is the point? The point is the Treats ligament, and the Treats ligament just comes from the diaphragm to a point in the small intestine called jejunal flexure. Okay, and everything before this ligament, the Treats ligament, it's a cause of upper GI tract bleeding, and anything after it or distal to this ligament, we call it a cause of lower GI tract bleeding. Okay, so if the pathology was in the esophagus, may it is cancer, may it is esophageal varices because of a problem with liver cirrhosis or portal hypertension. Maybe it's a problem in the stomach. Maybe it is peptic ulcers leading to bleeding. Maybe it is duodenal ulcers. Okay. So now I think I finished the signs and symptoms of upper gastrointestinal tract bleeding, and now I will go to the lower GI tract bleeding signs and symptoms. Okay, what about the patient comes to emergency room, and I will diagnose it with the conditions of lower gastrointestinal tract bleeding? How he or she will come to the hospital? Okay, this is the patient again. This time his face is not his face. No, he's sad. He's sad. Okay, a patient with lower gastrointestinal tract bleeding. I think I said it that the hematochezia, it is the typical presentation, and it is the most important symptom for patients with lower GI tract bleeding. So this I will firstly draw that he defecates a stool with bright red blood. Okay, so hematochezia, it's very important. Okay, so this is the first symptoms where patients come with, this is not the first one, this is the most important one, hematochezia. Patients with lower GI tract bleeding, he will come with fatigue, weakness, syncope, with faintness. What else? He may suffer from shortness of breath, sweating, okay, and hypovolemic shock. He will suffer from tachycardia and hypotension, and as I said, loss of consciousness maybe. Okay, so patients come with fatigue, paleness, fatigue, loss of consciousness, also syncope, hypovolemic shock. What else? He may comes with anorexia, suffering from anorexia. Okay. But what the thing that makes patients come to the hospital with sadness and afraid of? It is the hematochezia. He says that I find the blood clots mixed with my stool, or it is just I found the blood in my underwear. Okay, a patient with lower gastric intestinal tract bleeding, he may also come with melena, and someone here will shouting, how he come with melena for upper gastric? No. You have to know that melena may if the segment that affected it is the ascending colon, or if it was the distal part of small intestine. Okay, it will come with what? It will come where the blood will come black and you defecate melena. Okay, so if a patient come with melena and then I discovered that the problem is lower gastrointestinal tract problem, okay, or bleeding, I will know that the problem is in the ascending colon, in the right colon, or in the terminal ileum, or in the terminal ileum. Yes. Okay. So it's not like a rule melena for upper gastric intestinal tract conditions, bleeding conditions. No. Okay. Patients may come with abdominal pain and may not come with abdominal pain, so it's not really specific. Okay. I hear someone ask what is conditions of lower GI tract bleedings. There are a lot of conditions, and you can think about it with me, like hemorrhoids, like diverticulosis in adults, angiodysplasia and diverticulosis comes with really massive bleeding, and also Meckel's diverticulum maybe in children. What else? Ulcerative colitis, Crohn's disease. There are lots of conditions. Okay. So these are the signs and symptoms for lower and upper gastrointestinal tract infections, bleeding. Sorry, and I have to say something that if patients come with hematochezia, melena, fatigue, loss of consciousness, shock, shortness of breath, we have to exclude the upper GI tract bleeding. How? By upper gastrointestinal tract endoscopy and by nasogastric tube. Okay, and thank you.